My journey from competitive swimmer to supermodel and actor to fitness enthusiast, including victories at Ironman and Ultraman and running from Delhi to Mumbai, has been an incredible adventure filled with the thrill of the unknown at every turn. Looking back, I feel grateful for pushing beyond fitness boundaries, which keeps my spirit youthful. Hi, I'm Milind Soman, and today I'm excited and expert in cardiometabolic health, specializing in diabetes management. Our goal today is to deepen our understanding of glucose management alongside cardiovascular risk assessment and management. This discussion will illuminate the vital connection between glucose levels and heart health. Doctor, my first question. We often hear about heart risks tied to diabetes. Could you help me understand the effect of glucose control on heart risk? And what is the ideal HbA1c range?
Hello, Milind. Diabetes is one of the risk factor for cardiovascular complications. Uncontrolled diabetes leads to excessive cholesterol level formation in blood. Ultimately, the excessive cholesterol level gets deposited in blood vessels and can lead to coronary diseases. In uncontrolled diabetes indirectly affects the microvascular vessels supplying the blood vessels. And ultimately, the vessel damage leads to loss of elasticity and increase the stiffness of arteries, which ultimately results in the increase in blood pressure and excessive pressure over heart. So the diabetes will ultimately cause the uncontrolled hypertension, and also there is an increased risk of excessive cholesterol level, which resulting in atherosclerosis and blood vessel damage supplying to heart. Target HbA1c level in diabetes is 6.5, but yes, we can more aggressively control the HbA1c, and what target can be achieved in the diabetic patients. And if we achieve more control of HbA1c, we can prevent these complications over the time. So ultimately, this is diabetes is a silent killer, and we can control this silent killer diabetes with proper HbA1c control.
Thank you, doctor. Could you shed more light on heart risks and tools to measure them?
Cardiovascular risk assessment means chances of developing cardiovascular complications over the duration, which is mostly considered as a 10 years. This is just a evaluating tool which can be evaluated by various tool and calculators available like Flemmingham Risk Score, ACC, AHA, and QRISK 3 scoring system.
Thank you, doctor. My next question. What does a risk score signify? What insights can we draw from a 10% QRISK-3 score?
This includes various parameters like blood cholesterol level, kidney parameters, duration of the diabetes, race, ethnicity, sex, and age also. Out of these tools, the QRISK 3 scoring system can be the best scoring system as it has been studied in the Indian population residing in United Kingdom. So it will be more reliable to Indian population. A 10% of QRISK 3 score means a person having a 10% chance of developing heart attack or stroke over a decade. The patient who are comes in this category, they don't be panic, because this risk scoring system just give an idea that the patient have a more risk of developing these complications as compared to the normal people. So the risk calculator helps us to categorize the patient and help them to specifically look after over their severity of the disease.
My final question is, how can we actively reduce our QRISK-3 score? And what aspects are within our control?
As I already told that the QRISK scoring system include various parameters like blood cholesterol level, blood pressure, blood glucose level. So it also includes lot of factors which are not under our control like age and sex. But the factors which are under our control like blood cholesterol level, blood glucose level, blood pressure, we can control these parameters to reduce the risk factors. Also, quitting smoking and tobacco chewing can be one of the wonderful factor which has a lot of impact over the risk scoring system.
Thank you so much for sharing these. I hope this discussion inspires clarity about diabetes and heart risk reduction. Please feel free to reach out to the doctor for further insight.